Hello and welcome to the Week 2 Wrap-Up. This is your instructor, Carissa Dulke. This week in the wrap-up, we're going to just focus on a couple things from Week 2 and give us a kind of a look into Week 3. So Week 2, we had a discussion on lifestyle and genetic factors that increase the risk of cardiovascular disease. I was really happy to see the research you guys did and a lot of the information you pulled. You guys used a lot of personal stories, which was great. I really like to see that because that helps get you more involved with the topic. So kudos on that front. You guys did a great job. There was much improvement from Week 1, especially when it comes to plagiarism and citing your references and all that kind of stuff. So good job with that. You also had a learning lab and an assessment or a test, and the grades on that were really good. So I was really happy to see that. You guys are focusing on your chapter. Make sure you read the whole chapter. I know the way the syllabus is, it kind of gives you little pieces you can read, but I would suggest reading the whole chapter just because you're going to see pieces kind of bounce around from it, just because if we get a test from the book, it's going to cover the whole chapter or pieces from the chapter. So just make sure you take a look at that. And if you have any questions about it, definitely let me know. More than happy to help you. In Week 3, we're going to be discussing the cardiac cycle. So some kind of do's and don'ts for discussing the cardiac cycle. You know, you're welcome to kind of discuss what the cardiac cycle is, but the discussion actually has you involving the EKG or ECG as part of that. So what I suggest is that you guys you have to do your research because you have to have at least one reference, but make sure you use that just to help guide you. It should not be a majority of your post in quotes, no more than 10%, and I've stated that on some of the grading notes. No more than 10% should be direct quotes. It should be in your own words. It's only a 150-word discussion, which is a very short discussion. That is really a short discussion. So make sure no more than 10% is in quotations. Use your own words. So what did you learn from that? You can bring in diseases, you can bring in kind of how the EKG can be used, kind of your role as a medical assistant with the EKG, so you can tie in a lot of that. Just make sure to discuss what you've learned about the cardiac cycle, not quotation marks, what you copied and pasted from another author. What did you learn about the cardiac cycle? And then, kind of tie that in. Okay, so when would we use an EKG and how would it be used? What would we be looking for? As a medical assistant, when do you think you would use it? That type of thing. So there's a lot of room for interpretation and discussion with this. So please make sure you use that room. And like I said, just be very careful with your quoting this week, just because I don't want to see more than 10% quotations in your post. So any questions, let me know, but I look forward to seeing how this week goes with the discussion. So you'll see me bring in some diseases and some when it comes to what we look for with an EKG or an ECG, so I'll be bringing those in as well. So you guys have a wonderful Week 3, and let me know if you need anything.